Today we would like to present the topic of music therapy as an intervention for labor pain management. Pain management is of utmost importance to clinicians and mothers alike. Pain is unavoidable during labor, but our goal is to make it as tolerable as possible and to reduce suffering. Childbirth should be a positive experience, and with the use of music therapy and other complementary and alternative medicines, we can help women have a more satisfying experience. Women can choose many paths in managing their pain. They can go all natural. They can use pharmacologic methods like epidural analgesia. They can employ music therapy to soothe their body and mind, or they can choose a mixture of both pharmacologic and alternative interventions. Our job as healthcare providers is to be abreast of the latest evidence-based practices and the research that supports them in order to better serve our clients. Our PICO question was, in women going through labor, how effective is acupressure and music therapy compared with no pain medication at relieving pain? Here is a breakdown of the studies that we used to investigate the effectiveness of music therapy and acupressure as a means to manage pain during labor. All the studies were high quality and published in reputable journals. The design of this study is a single-blinded randomized controlled clinical trial. Women were randomly assigned to the control group or the experimental group. Pain was assessed 5 times, before the intervention, once in the latent phase, once in the active phase, once in the second stage, and once again 2 hours postpartum. The data supported the hypothesis that the use of music therapy alone can help in reducing pain for laboring women. One strength of the study is that it had a lot of literature to support it. Another strength is that the VAS pain scale, a scale where respondents specify their pain level by indicating a position or number along a continuous line between 2 endpoints, was used. This is a well-established and reliable method for assessing pain. It also investigated the effects of music therapy at all stages of labor, and the findings were conclusive. Also, music therapy does not pose any harm to the patients and is a very feasible pain management method. A weakness of this study is that it was conducted in Turkey, which may make it difficult to relate to Western medicine practices and culture. This study is of statistical and clinical significance. The quality and strength of evidence gives great indication that music can be used in the clinical setting as an inexpensive, feasible, and harmless way to manage pain in laboring women. Our table shows that each of the potential interventions have strengths and weaknesses. Asking patients to bring their own music is free and easy to implement, but it has a low potential outcome because it puts the onus on the patient to prepare beforehand and have access to portable music. Providing a radio for patients involves moderate costs, but is not easy to implement because it involves procuring and installing additional equipment into every room. It also has a weak potential outcome because of the lack of soothing music on radio stations. Providing a docking station and speakers presents the same challenges as providing a radio. Bringing in an actual music therapist would provide a high potential outcome, but it is the most expensive option and the most difficult to implement due to scheduling and staffing concerns. The intervention that scored the highest feasibility ranking was providing music to our patients through the bedside remote and TV. This intervention involves moderate cost, high potential for outcome, and easy implementation. In summary, we would like to recommend providing music to our labor and delivery patients through their bedside remote and TV as an effective way to reduce pain. After assessing the feasibility of each idea for implementation of music therapy, we are highly supportive of providing music to our patients through the bedside remote and TV. We recommend that multiple radio channels be added to our TV package that provide a variety of soothing music for our patients to choose from. Although this is not the easiest intervention to implement, it is inexpensive and it has the potential for the best outcome. We would like to take a twofold approach to communication and marketing. The first thing we would do is communicate our findings internally with nurses and other staff. We would update them on the evidence that music can reduce labor pain, and ask them to offer music to their patients. We would send the information out through internal email, as well as asking charge nurses to reiterate the information during huddle. The second piece of communication and marketing would include adding information to our marketing materials. Many hospitals offer brochures or informational packets to expectant mothers. In our marketing materials, we would cite the evidence that music helps with labor pain, and we would let the mothers know that our hospital now provides a selection of music for laboring mothers. We believe that by communicating this information to both staff and patients, the service will be utilized and patient outcomes will be improved.